Greetings, everyone. This is Dr. Cadet, internist and infectious disease, and I wanted to talk to you about the impact of COVID-19 on primary care. But first of all, I wanted to say condolences to the family and friends of one of the greatest actors, Chadwick Boseman, who just passed. Our heart goes out to the family and friends. May he rest in peace. Well, I wanted to give an update on COVID-19, where we at, and also talk about the impact of COVID-19 on primary care. As of August 29th, 2020, we have about 6 million cases in the US, and most of those cases are found in California at nearly 700,000 cases with around 13,000 deaths. Texas, about 632,000 cases with nearly 13,000 deaths. And in our state of Florida, about 619,000 cases with a total of 11,000 deaths. Now, for the state of Florida, the cities that are more affected include Miami-Dade with around 157,000 cases with 2,400 deaths. Broward, over 70,000 cases with around 1,200 deaths. Palm Beach, 42,000 cases with almost 1,200 deaths. Hillsborough County, around Tampa, over 37,000 deaths with, 37,000 cases and 545 deaths. Orange County, about 36,000 cases and around 400 deaths. So COVID-19 pandemic cases are slowing down, but they're still there, actually, and people are still dying. And I wanted to talk a little bit about what to do to avoid or to prevent the transmission of COVID-19. Number one thing is we need to know that we don't have too many weapons to fight this pandemic. The weapons that we have include social distancing, washing of hands, face covering or wearing of mask, and a few medications that we have, such as plasma, remdesivir, steroid dexamethasone. So we really don't have a whole lot other than those medications. The convalescent plasma, there are some good studies, but there are some confounding studies as well. But convalescent plasma are basically they get it from people who recover from COVID-19, and they use the plasma of those patients to actually help those that are afflicted with the condition. So what to do to avoid transmission? Number one thing is to stay home if you're sick. If you're having fever, you're having symptoms, it's really important to stay home. And the second thing that you should do is to keep your distance, minimize or avoid shaking hands. And I know it's really tough because it's hard for me being so used to shaking hands. Number three things. Number three, wash hands frequently. Number four, wearing mask. Number five, you need to take care of yourself. Eat balanced diet with a lot of fruits and vegetables, and get appropriate sleep. And number six, when you cough, please cough into your elbows. And number seven, you need to clean the common surfaces often. The doorknobs, very important to clean those. And number eight, if you're not feeling good, it's really important to contact your physician. And if you're feeling worse, you need to go to the hospital. Please do not stay home hoping to get better because you think you have a cold. That's how a lot of people end up having complications and die. And this is very real. A lot of people have died, and as a physician, as family member, as a friend, I have known quite a few people who have died from this horrible virus. One of the things that I wanted to talk about is really testing. It's really important to test and contact trace patients who are exposed. So there are a few places that are testing for COVID, and some of those places are at the convention center on 5980 Destination Parkway. You must be 5 years and older, bring photo ID, no symptoms required, and you must stay in your car, maximum of 5 people per car, but the vehicle windows must be operational. And there's also another testing site at the South Orange Youth Sports Complex on 11800 South Orange Avenue. And the phone number is 407 836 3111. Okay? So before your appointment, you have to understand that the test is free, no insurance required. And the next site is community health centers on 840 Mercy Drive, Orlando, Florida 32808, and the phone number is 407 905 8827. Another site is on the east side of town, East Orlando, 11881 East Colonial Drive, 11881 East Colonial Drive, Orlando, Florida 32826. Phone number 407 322 8645. And you need to bring a picture identification. No charge for the COVID-19, but if you have insurance, please bring your card. They will serve you there. And now I wanted to get into the nitty-gritty part of the presentation. Now, some people are asking whether it is safe to go to the doctor during this pandemic. Well, if you are concerned or wondering if it is safe to see your doctor, your primary doctor or specialist during COVID-19, from my perspective, yes, it is safe to visit your doctor for non-COVID related issue. As an advice, you should not delay your healthcare due to the fear of COVID-19, even though we're still in the middle of the pandemic. Now, the difference is that the difference between February, March, and now is that we currently have system in place to keep people safe and prevent the transmission. Otherwise, delaying acute and chronic condition can be harmful to you and your family or your friends. Now, keeping you safe and healthy is most of the clinics' top priority, clinics and hospital priority. They have strict CDC guidelines that are being followed, and there are rigorous safety and cleaning protocols in place, including modifying the facility for greater social distancing, uh, i.e., having patients wait outside or in their car and spacing out lobby chairs by at least 6 feet. So, screening for COVID 19, they do that. They do screening for COVID 19 along with taking temperatures, checking symptoms, and wearing of mask or face covering. So, those are the measures in place to make sure that you are safe. Now, there are also workflow and infection control measures that have been adjusted accordingly to promote your safety. If any patient is suspected to have COVID 19, the medical history is taken at a distance over the phone or via video calls to minimize the risk of transmission to other patients. Now, in some clinics, even the blood draws are drawn in the exam to minimize traffic and unnecessary exposure. So, with those measures in place, I feel confident as an infectious disease specialist to say that um, it is safe to get acute and chronic care despite COVID 19 in the background. Now, what about time sensitive reasons to see the doctor during COVID 19? Well, some of the time sensitive reasons include hypertension, diabetes, COPD, chronic kidney disease, infectious disease such as HIV, hepatitis B, hepatitis C, as well as regular checkups, including uh, child development. It's very important that you take your baby to the doctor to see whether the baby is developing well. And also lab visits, very important. Now, these complex conditions often require frequent medical visits, frequent evaluation by providers managing them, and yet, unfortunately, they've been deferred. Now, unfortunately, some patients don't feel safe to resume the medical visit in person if needed. Some patients have not filled or refilled their medications out of concern for COVID 19. That should not happen right now. As a result, uh, patients with deferred care management of those above conditions, such as diabetes, hypertension, and so on, that would put their health at risk. So remember, my friends, the delay can actually lead to significant impact even in the among the youngest patients. So during the COVID-19, you can still see your care team through video visits, audio visit, or phone visits, or in-person appointment if needed. Now, some people may ask, what about the medically necessary procedures, imaging, and lab tests? Well, as clinicians and hospitals have gained more personal protective equipment and roll out extensive safety measures to keep patients safe, such as social distancing, face mask, and washing of hands, most previously delayed visits, such as surgeries and procedures are not being scheduled. So it is safe now to get your medically necessary procedures done, get your imaging done, and get your labs done. What about the time sensitive preventive measures, colonoscopies, mammograms, and pap smear? Well, those procedures are example of screening that can detect medical condition, and some of them serious, that you don't want to delay those procedures because they are very important in terms of preventing cancers. What about childhood and adulthood immunization? Vaccination schedules are designed with you as the patient in mind, with your immune system in mind, to help protect against preventable disease like measles, mumps, rubella, polio, tetanus, pneumonia, HPV, and hepatitis A and B, to name a few. Unfortunately, though, the rate of immunization have decreased by nearly 50%. Sad. And even more sad, the highest rate among patients from 19 to 15 years old, 19 to 50 years old, which is a concern. And we have some key immunizations um, among patients, especially among those age groups, such as influenza, HPV vaccine, hepatitis A and B vaccines. They are designed to be given based on schedule, even during COVID 19. The flu vaccine is more significant than ever due to the possibility of what is called quote unquote dual pandemic, which is actually hard to differentiate clinically. Because when you have the flu, you have fevers, cough, shortness of breath, sore throat, and when you have COVID 19, you have the same exact symptoms: fever, cough, shortness of breath, sore throat, muscle aches. So it will be hard to differentiate. So the advice is you need to get your flu shot first thing uh, when it's available, around preferably around October. So the flu shot is recommended for anyone greater than 6 months old. You can either go to your doctor's office or to a pharmacy to get it. But you should get it at least, like I said, by October 2020 to actually protect you against a worse outcome in case you contract COVID 19. Remember, it takes about 2 weeks for immunity to kick in with the flu. So the sooner the better. Now, delaying those vaccines that we mentioned, the flu shot, the HPV, the hepatitis, can actually lead to serious consequences, such as outbreak of the flu, of measles, hepatitis A, and so on and so forth. Even delaying the vaccines such as HPV can actually be can have negative consequences. As you may know, HPV can prevent cervical cancer and colorectal cancer as well. So it's very important that you get your shots. What about emergency like heart attack, stroke, stomach pain, abdominal pain? Well, in the medical emergency, every minute counts. So getting care quickly can make a big difference in your treatment and can help you have an easier recovery. So it's really important to get checked to go because the hospital setting really it definitely with infection control measures being in place, you should be safe. You will be safe. In closing, remember, we really don't know which direction this COVID pandemic is going. Even though things have gotten better in certain parts of the country, so we really don't know if we will have a second wave, whether or not we will need to scale back those face-to-face medical visits we currently have. So we don't want to defer on screening and preventive measures such as colonoscopy, mammograms, pap smears, to name a few, and certainly immunization, which are life-saving measures. So currently, while we have some access to face, we can actually leverage this opportunity for face care to perform the necessary screening tests and administer the vaccines that are needed. Now, if you don't have a medical home, I will be delighted to care for you at those two locations at the Orange Blossom Family Health main office on 232 North Orange Blossom Family Health, Orlando, Florida, zip code 32805, or you can come to the Orange Blossom Family Health, Ivy Lane on 4426 Old Winter Garden Road, Orlando, Florida 32811. Thank you for your attention and God bless you and be safe.